Welcome to Wellness Wednesdays, a web series where we examine how COVID-19 has impacted our healthcare system and what you need to know as you re-engage with your physician and get the healthcare you and your family needs in 2022.
Today on Wellness Wednesdays, we're going to be focusing on women health issues, specifically pelvic floor disorders. So pelvic floor disorders are issues women face after childbirth and later in life. And they involve issues related to the support of the pelvic organs, as well as issues with urinary and bowel control issues. It can also, in some instances, involve pelvic pain. Roughly 25% of women will experience a pelvic floor disorder in their lifetime and seek care for it. So while it's an embarrassing problem, it is not an uncommon problem. Here at UT Medical Center, the Pelvic Floor Center offers a unique multidisciplinary approach to women who have pelvic floor disorders. The center is composed of urogynecologists like myself, urologists, colorectal surgeons, as well as pelvic floor physical therapists. So common symptoms of pelvic floor disorders vary based on the exact problem. With pelvic support issues, women present with bulge or pressure in the pelvic area. With bladder control issues, women commonly present either with urine leakage when they cough or sneeze, or with urine leakage on the way to the bathroom when they need to go. With bowel control problems, women come in with issues related to stool or gas leakage. Treatment for pelvic floor disorders are specific or unique to the exact problem at play, and there are a broad spectrum of treatment options that are available to women. There are more conservative measures that don't involve medicine or surgery, and then in some instances there are options where medications can help, and then in many instances there's options where surgery can help. So we really tailor the care to the patient and what she wants. So as you can imagine, through COVID, a lot of access to healthcare has been limited or delayed, and as a result of that, a lot of women who would have sought care for these issues have not been able to get that care that they need. And now that we are on the back end of the pandemic, it's giving an opportunity for women to get in and see providers to help these issues. So for women who would like to be evaluated for a pelvic floor disorder, they can talk with their primary care provider and get a referral to a specialist accordingly. Alternatively, they can go to utmedicalcenter.org, where we have a link for the Pelvic Floor Center. Through that center, they can contact a coordinator who then gets them in with the appropriate provider based on their symptoms. The coordinator for the Pelvic Floor Center can be reached directly at 865-305-6425.